Good day there. It's Unit 12, where we're going to talk about common diseases of horses and try and get all this in a one lecture segment here. So let's get to our diseases. The first one we'll talk about is acidosis. We've hit this one, of course, in cattle and a wee bit in swine as well. Horses are susceptible to acidosis. Primarily, this would be related to some feeding issues, whether they've been slug feeding some high carbohydrate feeds or something of that nature. It's often caused by that feeding program, and it is associated with some severe diarrhea, and then oftentimes just simple heat exhaustion. Horses can lose 10 to 12 liters of sweat per hour, so it's really, really important that they stay hydrated, especially when you're working them hard in hot conditions. Whenever they set into acidosis, you will probably see some rapid shallow breathing. They won't eat like they're supposed to and start to develop some symptoms of weakness. So best way to treat this one is some adequate salt in the diet. You know, all animals have a salt requirement. It's a great idea for horses just to have a salt block available because they'll consume it simply as a condiment and kind of help self-regulate that hydration status. But in order to treat acidosis, you might also want to give them either oral or intravenous sodium bicarbonate. That would be what your veterinarian would likely do if we ran into an acidosis issue where we've just acidified the gut way too much. Additional problems that you may see connected with acidosis is certainly hoof problems. We're going to talk about founder later on in this slide deck. But certainly colic, which we will hit on as well. But those two things will be probably tied to a condition of acidosis. Peritonitis we've hit on in both other species topics can happen here with horses as well. So I will not recover this one in any more detail other than to point out that you would have to be aware that horses can have the condition of peritonitis as well. So I referred to colic, and this is probably one of the most common disease issues with horses. And the great news is it's not contagious, but it's going to be caused by eating spoiled grain, connected with impaction, simple stress, whether you're trailering them and moving them to a county fair or a different location to ride, that can cause trigger colic. Parasites can trigger colic, of course. Wind sucking, and some of you may say, what the heck is that? Maybe we're working them really hard and they start breathing heavy, just inhaling all that air. Some of it getting into their digestive tract can sometimes trigger colic. Twisted intestines, and I have highlighted here intussusception. That is where the small intestine will kind of telescope inside of itself and start to, of course, cause twists and backups that way with gas bubbles. And essentially what happens is we have bubbles of gas, pockets of gas that accumulate in the small intestine and, of course, cause pain. This is very, very similar to what babies get, and it's very, very uncomfortable for horses. Horses are unique in the fact that they do not have a reverse peristaltic muscle movement. So they lack the ability to burp, consequently. So the gas has to move down the digestive tract and out the rectal cavity. Symptoms here is horses will have periods of pain. They'll paw at their stomach. They'll sweat profusely for what appears to be no particular reason. And the symptom of rolling is really, really problematic. So if they start to roll, that will further twist their intestines, and you want to prevent them from doing that. They'll also probably not have any bowel movements, so that they won't be producing any manure. Prevention strategies, slow and methodical feed changes if you need to do that. Regular exercise so they stay in proper body condition and proper physical condition. Feed good quality hay. Stay away from the moldy, dusty stuff. Sometimes that might be cheap, but it probably will cost you in the long run. And then deworm on a regular basis. Horses should be dewormed about every quarter of the year. Treatments then, first things first is keep the horse from rolling down or lying down or rolling. Walk them. Sometimes that simple movement will trigger some of those gas bubbles to release, and you can get them moving. Maybe give them a laxative, and in the meantime, call the veterinarian if you think you have a significant problem. Scours, again, we've talked about in pretty good detail in the previous two sections, And I'll just point out here with Scours that it's probably unlikely to cause a problem in foals, even though it is somewhat possible. If it gets extreme, you would certainly want to call the veterinarian, but it's probably associated with either a dietary change or the mare being in heat while the foal is nursing. That would trigger it. But of course, all the clinical symptoms and treatments and issues would all be similar to cattle and pigs getting Scours. Salmonella, again, we hit on with regard to cattle and swine as well. The treatments here are no different. The symptoms here are no different than the either two. So again, manage your bird populations, manage your risk, and certainly keep your facility in clean, well-kept conditions. Retained fetal membranes, I know we've talked about these as well in swine and cattle, but need to point out in horses, horses should clean. They should expel all those fetal membranes within 30 minutes. It's quite rare for them not to do it. However, if they do, that is a urgent problem for a horse owner, for a mare that has not done that. So if that does not occur, you need to call a veterinarian. They trigger into severe infections from a uterine standpoint, sepsis and death quite quickly, and so you would want to treat that condition almost immediately if you can. So how do we prevent it? That's the main thing. Keep mares in proper body condition. Feed them a well-balanced diet that has the proper blend of energy, protein, and mineral, and they will more than likely go ahead and clean. And of course, keep them properly hydrated. But again, mares should expel those membranes within 30 minutes, and most do. But you just want to make sure that you are monitoring them carefully so that they do, in fact, get that done, and therefore don't have any infection problems. Leptospirosis, again, one that you've already seen a couple times. Not going to recover this one. It's again considered repeat Brito syndrome and would be associated with some gestational problems. Strangles. Here's another one that is quite important. A bacterial disease that is going to challenge the breathing of the horse, as well as probably cause some lymph node swelling and nasal discharge, almost like a cold. But it's caused by a bacterial infection, and usually it's going to occur in younger horses, so less than 5 years of age, and it's fairly common at boarding stables and shows, where we start to reblend the population of horses together. One of them may be carrying it and triggers an outbreak amongst all of them. This is one that's unique because it will trigger in horses a pretty high fever response, somewhere between 104 and 106 body temperature, and that snotty, nasty discharge from the nasal cavity, and some significant swelling under the lymph nodes, under the jaw, which actually could swell to the point where they abscess and drain somewhere 7 to 14 days later. That would be, of course, quite problematic to treat. You'd be wanting to really sock them pretty good with antibiotics, so to speak. So how do we prevent it? Some boarding stables have a strict have a strict quarantine policy, put strict monitoring or testing policy for horses that are coming in. You can vaccinate a little bit for this one, even though it is a bacterial type disease. There's some vaccination to help build up some titers for this one. But treatment will require pretty significant levels of antibiotics, and you'd want to isolate that horse for a while. And then, of course, if you have some swelling issues, you'll probably go to a soft pelleted feed. They will not be down for eating very much hay at this point in time with this type of condition. Next is tetanus. So this is a high risk for horses because of the amount of time they spend on pasture and associated with fence line and things of that nature, and because horses have both top and bottom incisors, different from ruminants. They can pick very close to the ground, so it's not difficult for them to pick up something that might then cause them some kind of injury. So it's occasionally associated with tail docking or castration or dirty equipment like we talked about before. But again, tetanus is typically in horses, it's a deep tissue injury that heals over the surface. So we got poked by a nail, deep tissue that's rusty. We got the stabbed by some broken barbed wire fence that causes a deep tissue injury and heals over at the surface, but creates that toxin release that's deeper in the tissue. And so all of the treatment and prevention approaches are listed here, very similar to the other species that we've hit on. West Nile and equine encephalomyelitis is a little bit unique here. Again, spread primarily by mosquitoes, and it is infectious. West Nile became semi-popular, say, about 15 years ago or so, or problematic, I should say problematic, not popular. And again, birds are an intermediate host, and then mosquitoes feed on them and can pass it to horses. So symptoms or signs that you will see is a lot of nervous trembling, depression, maybe some impaired vision. They'll kind of act like they're blind a little bit. And so generally it's supportive therapy and hope. And I say that somewhat in jest, but it's a lot in earnest, because there's not a lot of treatment here. If it comes on very quickly, it's highly fatal because it's just a rapidly developing viral disorder. So supportive therapy is your best way to go, and vaccination, especially when you have horses at high risk. The other good thing to do is just do not have puddles of standing water, buckets that have standing water in them through the spring and summer and fall time, so that you reduce the amount of mosquito breeding ground. Next is white mussel disease. Again, common in low selenium soils. We've hit on this one in the prior two sections. Would be certainly problematic for horses because of the amount of time that they may spend on pasture. And if your soils are lower in selenium, white mussel disease can set in, which would, of course, then cause atrophy of the muscles and stiff movement, stiff development of muscles, and therefore potentially really a challenge in terms of a horse's growth and development physiologically. So laminitis and founder, I alluded to this one earlier, and this would be swelling of the hoof laminate. About 70% of these cases are related to some kind of feed problem primarily, but you also might have other issues like acidosis that we mentioned, or genetics. This may be caused by incorrect hoof trimming. A farrier that is not well trained or makes a large mistake could cause laminitis or founder. Signs of this one, of course, would be limping, painful gaits, crossing legs, very soft hoof tissue, ulcers of the hooves, very long hoof growth. I mean, horses, if left unchecked and have laminitis issues, they can grow almost like elf shoes on their hooves, which is, of course, very painful for them and not proper, will cause all kinds of conformational breakdowns. So prevent this by proper nutrition, secured grain so they can't get into it, and a really good farrier and proper hoof trimming practice. And if this happens, treat with anti-inflammatory medication prescribed by your veterinarian, of course. You can also soak hooves in water for about 10 to 15 minutes. It's ice water, sometimes salt water blend, 2 to 3 times a day to get that inflammation out. And then just simple stall and rest. Other diseases, of course, as we wrap this one up, and I've referred to ringworm and abscesses and parasites. Parasites I highlight here with horses because the amount of time that they spend out on pasture, and again, clipping close to the soil line, they are fairly susceptible to high levels of parasite load. So you want to, again, deworm on a quarterly basis with oftentimes an alternating anthelmintic so that you catch all potential worms. So your take-home messages here as we summarize these things. Again, we want to be able to identify major horse diseases and their risks. Make sure that you understand causes, symptoms, treatments, and prevention, and then examine the economic risks of horse disease and what's going to be really problematic and what you need to prioritize on your operation in terms of treatment, prevention, and control. Thanks for tuning into this segment. I look forward to interacting with you more in the course and answering any questions you may have. Have a great day.